This is the Garden Street site of Brockville General Hospital, the location of the Stroke Rehabilitation Unit in Brockville. It will be your temporary home during your rehabilitation program. The typical length of a rehab program is 6 to 8 weeks, but your stay may vary depending upon your specific needs. In this video, some members of our rehab team will explain how they'll help you reach the goal of maximum possible independence in your everyday life. You'll also meet Wanda and Robin, who have graciously helped us make this video by demonstrating some of the rehab exercises that were part of their particular programs. Your program will vary according to your own needs. Then we'll show you some of the facilities and services that will be available to you and your family during your stay with us. And now, meet two of our nursing staff.
With Team Leader, I coordinate appointments, organize the physiatry rounds, and any concerns or questions you would have, they would be addressed with me and I would deal with them and get back to you.
It's very rewarding to see patients come in here to improve, and I will help on your any daily activities or care you need assistance with.
Your daily physiotherapy sessions are an important part of your progress towards independent living. This therapy will help improve your balance and mobility skills. The physiotherapist will also help you with pain management and in preventing joint stiffness and muscle weakness.
The first time you see me, we'll be at your bedside along with the occupational therapist, and we'll be doing what we call a bedside assessment, which is to just get to know you a little bit better and to see how you move in your own room. After that, you'll probably come up to this room, which is called the Physiotherapy Gym, and we'll be doing a greater detailed assessment on how you're moving, what your strength is like, how you're walking, and how your balance is. Once we've determined that, we'll set you up with a very individualized program specifically for you to help you achieve your goals, which may include things like walking better or doing stairs or being able to go home. We'll use some of the equipment in this room, like the parallel bars. We might use balls, we'll use staircases, weights, and other types of therapy equipment.
You'll also be receiving occupational therapy to help you reach your full potential in independent daily living skills.
Today we're working on a bit of a puzzle, and it gives Robin the opportunity to practice using his left hand to manipulate the pieces, and it also gives me a chance to evaluate some of his cognitive and perceptual skills. So we have a kitchen here in the OT room that we use quite regularly. A lot of the rehab patients are required to make their own meals when they go home, so that's something that we practice here quite often. And then there's a switch on the handle there. Perfect. It should turn itself off in a minute.
Your therapy doesn't have to be all work and no play, so a recreational therapist will help you learn or redevelop many skills by using games and other enjoyable tools.
While you're here, we'll use many different areas of our facility. I usually assist our occupational therapist in a lot of your kitchen activities. I help in assisting her in teaching you how to use special devices such as this one-handed can opener. As well, we have a special cutting board that you can use that helps chop. It's also on a lever, so it makes preparing food much easier. As well, we have some of the gripper mats to help stabilize while you're cooking. We often use the cooking to incorporate into social activities. We do it as a group, so you can mingle and talk about different things that have affected you with your stroke. As well, we try and target some of your leisure interests. So we sometimes work on some standing balance, and we might play a game such as badminton. We also use different activities such as bowling and various things such as pool that we have available to us as well. One of the things that we're working on is some of your spatial issues concerning neglect. We might work on puzzle activities or games such as Yahtzee. That will help you work on developing some of your neglect, whether it be left side or right side, depending on what your stroke has left you with.
Hello, I'm the pharmacist on the rehab unit. Once you're admitted to the rehab unit, the pharmacist will review the list of medications that the doctor has ordered for you. The pharmacist and the rehab team will educate you and your family on the medications you are taking. We will also work with you to determine the safest way for you to take your medications once you're discharged home from the hospital.
Sometimes a stroke will affect your ability to communicate. If that's the case, our speech-language pathologist will work with you to assess your needs and create a customized program to suit your needs. Your family physician will continue to be your primary doctor throughout your rehabilitation program and will be responsible for prescribing your normal medications. You'll also be working with a physiatrist who is a specialist in diagnosing and treating patients who have suffered strokes.
Your treatment will involve working with a number of therapists, physicians, and other healthcare professionals with expertise in stroke rehabilitation. Through your active participation as part of this treatment team, we'll work together to optimize your recovery and maximize your functional independence. We look forward to meeting you and working with you.
We have the facilities, staff, and volunteers to help you with your spiritual needs while you're with us.
When you come to the hospital, we have a monthly calendar where we do have organized multi-faith chapel services throughout the month. And we do invite you to those, but we also work with your rehab team to make sure that we do not interfere with the time that you are taking for your rehab tests and exercises that you may have. So we sort of coordinate that with the team when you get here.
Ecumenical and multi-faith services are available. A hair salon is conveniently located right in the hospital in the basement. There's a number to call to book your appointment. There are a number of personal items that you should bring with you to the rehab unit. Comfortable clothing that would be easy to put on and take off. Comfortable lace-up walking shoes. And if you use any of the following, be sure to bring them along. Glasses, dentures, and a hearing aid with spare batteries. A wristwatch will be very useful, and a calendar. A copy of any special diet which you've been following at home. Any equipment that you were using at home prior to your admission, such as a cane, a walker, or a foot brace. All medications that you were taking at home prior to your hospital admission. And finally, toiletries such as shampoo, deodorant, a comb or brush, a toothbrush and toothpaste, electric shaver, makeup, and so on. During your free time, you may wish to have some quiet time by yourself or with your family members. There are several areas in the hospital for that very purpose. This lounge on the south end of the 5th floor has some spectacular views of the city and the St. Lawrence River. This TV room on the 2nd floor is available for your enjoyment. This spacious residence lounge is located on the ground floor. As you can see, it has a beautiful aquarium where you can watch the fascinating fish, a planter stand for those who enjoy flowers and plants, and even a piano. On those pleasant warm days, you can sit outside on this spacious deck. This is occasionally the site for activities such as barbecues. Your family members are encouraged to be active participants in your recovery. For their convenience while they're here, the hospital has a number of amenities. The cafeteria is located in the basement. Lunch is served from 11:30 a.m. until 1 p.m. There is a different menu each day, and the prices are very reasonable. Outside of the lunch period, the cafeteria is open from 6:30 a.m. to 1 p.m. Monday through Friday. There are also vending machines available 24 hours a day. They're located near the staff entrance. This nicely stocked gift shop is located in the main lobby. Parking is very reasonably priced. It's paid with loonies and toonies, and change is available from this machine located near the doorway to the parking lot. Monthly passes are available. It will take time and work for you to reach the goal of maximum possible independence in your everyday life. Our role is to help you achieve that goal before your discharge from the rehabilitation program.